Hey, everybody, welcome back to another episode of the Daily Dental Rewind. I'm Dr. Jordan Kane Smith, founder owner here at Breathe Modern Dentistry and Element 8, and today we're going to talk implants. I had a wonderful lady a couple weeks ago arrive to our practice as a new patient, and multiple issues going on. However, we wanted to focus in for the time being and where she was having some pain, and that was her upper left premolar. So after a lot of conversation about different options and ways we could take her, we decided that the best road for her and the best longevity for her investment was going to be on an implant. So to do that, we talked about some gathering of information and some data so that we could take out the tooth and do what we call an immediate placement of an implant, which means once the tooth comes out, the implant goes right back in its space, which really allows us to have one surgery, heal one time, and it's very predictable. The body is in an effort to try and heal in that moment. And so studies are showing that is a wonderful way to place an implant when the bone allows us, or the architecture of the bone allows us to. So that's what we decided to do. And in order to do that procedure and do it very predictably, we wanted to get some information. So one, we got a 3D scan of her teeth. The second thing we did was we got a 3D x-ray of her teeth as well. And then in our software, we're able to merge those together. What that allows me to do is in real time see her mouth, but also the bone underneath her mouth. So when I decided to place an implant, I could predict which size of implant would make the most sense, how long it needs to be, and so on. And so we are very able to, we're able to very predictably do these things now with regard to the anatomy of the face, the jaws, etc., that we're placing implants into. And a reminder that the implant is really just the screw. It's a titanium portion, almost like the root of a tooth. The connector and the crown are something that usually come later in order to restore the tooth, the part that you see in the mouth. So for this visit, this first visit today that we did, we took out the tooth and then we placed the implant. Now, the surgical guide was made prior to, which really surprised her because the minute that the tooth came out, which took about 5 minutes, we were able to snap on the surgical guide and it puts the hole exactly where I need it to be in order to direct my burrs in order to place the implant in the right spot. So we took out the tooth, popped on the surgical guide, used our burrs a couple of times to make a perfect hole in the exact spot that the implant would go. And then before we placed the implant, we actually drew some blood from the patient. Now, we draw blood in order to do one thing, and that is to make platelet-rich fibrin. Platelet-rich fibrin is essentially a gel that we spin from your blood, and it has all your growth factors and healing nutrients and white blood cells that fight infection and so on. They're all concentrated into that PRF. So once we took out the tooth and prepared the site for the implant, we packed the whole socket site with that platelet-rich fibrin, because again, it's kind of a gel. And then when we place the implant, it just moves it out of the way, but it fills all the voids around the implant where the root shape was not exactly the same size as the course of the implant. So many times premolars, this may be too much information, but premolars are often oval in the root shape. And so if we're placing an implant that's perfectly circular in the middle, we're going to have some gaps on both sides. So I like placing that platelet-rich fibrin to help fill those gaps so we don't get bacteria and other things around the implant. The other thing it does is it's been research has shown that it will reduce pain, it will reduce the healing time of the area, and it reduces dry socket when you're just taking out a tooth. So it's something that we do for a lot of extractions as well. But anyhow, within 20 minutes from getting her numb to taking out the tooth and placing the implant in the PRF, she was done, and we put on a little healing cap so the tissue has something to heal around. So just to guide you back through, this is exactly the tooth here that we decided to move on from. You could see that there's a portion of the tooth on the inside that was left, but the outside of the tooth really had degraded to a point where there was not enough that I felt comfortable, even with a root canal, that we could get her restored in a way that it was going to last for her investment that she would have to put in it to do that. So that's why we decided to move on from it and to make an implant or a titanium root. So we had a better, stronger structure to build from as the time went on. So once we took that out, we placed in the implant. This is the final x-ray that we'd like to take right after we're done. So this shows the implant we placed today, and then this is the healing piece that we screw into the implant. That again just gives the tissue something to heal around. Now you don't see the PRF in this because the PRF is translucent on the x-ray, so that you're not going to see anything of the PRF. But that gel completely encompassed it and will help her heal tremendously, as well as it'll reduce her pain. So if you're considering having a tooth removed, not every situation is a good situation for an immediate implant. But if you're not a patient of ours, check with your dentist wherever you're at and see if they place implants often. Secondly, ask them if they do immediate implants. And then third, make sure they can predictably do that. If you have a lot of infection, not usually the best idea. If you have some defects in the bone around the implant, or excuse me, if you have defects in the bone around your roots of the tooth that you're removing, again, not an ideal and optimum time to usually do an immediate placement implant. Normally we'll just graft those sites And we'll let them heal for a couple of months, and then we'll go back and we'll place it into good foundation of bone. But anyways, very predictable procedure when planned appropriately. I hope you guys learned something about implants today. Hopefully you don't have to have a tooth removed and an implant placed, but I can tell you they're becoming a very predictable way to replace a tooth as time's gone on. So anyways, I wanted to share our technology with you, share our patterns of treatment in those cases, and I hope you learned something else again on today's episode of the Daily Dental Rewind. I'll see you guys on the next one. Thanks.